Thank you, Sarah. Good morning, everyone again. I would like to welcome you all to this meeting of the Improvement and Change Subcommittee, which has been held remotely, broadcast live and recorded for publication. I'm Councillor Reg Adairn and the Chairman of this subcommittee. For the benefit of viewers of the live stream, I'll now ask the Clerk to the Committee, Sarah Allen, to list the other members present today.
Thank you, Chairman. So the other members present today are Councillors John Cotty, Jim Creamer, Kate Fole, Tony Harper, Richard Jackson, David Martin, Diana Meal and Philip Owen. As well as myself, we also have the following officers present today. Service Director Marge Toward, Service Director Nigel Stevenson, Service Director Derek Higton, Corporate Director Melanie Brooks, Interim Head of ICT Mark Davies, Service Director Matt Neal, Group Manager Sue Milburn, Group Manager Rob Davies, Cloud Services Manager Stuart Reekey and Technology Partner Anne Morgan. Thank you, Chairman.
Thank you, Sarah. It sounds as though we're outnumbered by officers today, so we better get in there quick. So, moving on to agenda item 1, minutes of the last meeting held on the 22nd of September 2020. To ask the committee if the minutes can be agreed, and if you just show your hands, that would be helpful. Thank you very much. That's agreed. Thank you. So then I'll move on to the next one, which is apologies for absence. Do we have any apologies for absence, Sarah?
No apologies. All members are present. Thank you.
Thank you. And then item 3, declarations of interest by members and officers. See note below, disclosable pecuniary interest and private interest, pecuniary and non-pecuniary. Do we have any members or officers who want to declare an interest? Doesn't seem like it. So let's move on to agenda item 4. And agenda item 4 is, when I get there, turn the pages. Your Nottinghamshire, your future, council plan progress. And I'm sure you've all read the report. And I think, is it Rob Disney? Are you going to take us through this report, Rob?
That's right. Thank you, Chairman. Yes, I will. It's just to clarify, it's Rob Disney, not Rob Davis, as Sarah mentioned to start with. Nigel Stevenson is I think you might have heard just before the meeting started, in the role of glamorous assistant, as he put it, on this one, because he has generally a bit more success with sharing his screen than I do. We've just got a short presentation just to help members navigate through this report. Thank you, Nigel. We'll just start off with a brief catch-up on what we were doing with this update report prior to the pandemic hitting. It's quite a challenging report to report against the council plan. I'm sure members will recall previous versions of this update report, which came with a really hefty appendix and lots of statistics, which were, I think, quite difficult to digest and to come away with a clear sense of how the council was performing. So in part, to try and address that, we reviewed the planning and performance management framework in 2019, and that brought in a hierarchy of measures which links across to the hierarchy of performance reporting, and that's the triangle that you see on page 3 of the report. And this report deals with the top 2 segments of that hierarchy. Thanks, Nigel. So to pick up on that top segment first, the focus here is on the 12 council plan commitments for Nottinghamshire, and these are commitments. I think it's there's acknowledgement really that the council needs to work with all of its partners in order to achieve these commitments. There's a core data set in place for these measures, and those were agreed by Policy Committee back in May 2019. And you have all of those measures then in Appendix 1, and you'll have seen that that's a combination of the dial format of the for the core measures to show where those are currently, along with a narrative summary for progress against some of the key actions that relate to those. And it's quite a while since we brought this one, this update report. It was in January, and that related to the period up to the end of September 2019. So wherever we can, we've based the data on data up to the end of September 2020 to try to bridge the gap since we last reported. Thanks, Nigel. So just to walk members through Appendix 1, just to make it clear what we're looking at here, you'll see we've got an example screen here. So at the top, you'll see that it's highlighted the council plan priority. that that each one deals with. In this case, it's that first priority by way of example, and then beneath that we have the council plan commitments shown, and there are 12 of those in total, 3 for each priority, as highlighted there. And then on this screen, you see the dial performance measures for each of those, for each item in the core data set. Red indicates that an item's off target currently, and green is on target. And then just to clarify, at the top, the very top right-hand corner, there's a backward arrow. This is actually in the format of a dashboard, to which we are able to give members access for the future reports. And you'll see when you get that, you'll be able to navigate back to the home screen with that top right-hand backward arrow. And then the only other thing you're able to do really is to navigate between the screens that are displaying. So in this case, the black highlighted screen is the council plan measures.
Rob,
so
can we do that now, or is that something you're going to add to the to it later after this meeting? Is it?
Yes, we can do that after this meeting, Chairman. Yes, we can.
And then all members can log into that and find their way in through a link.
Exactly so. Yes, we'll publish the link round everybody, so you'll be able to go in and view this same. It's exactly the same information as you have here, nothing further, but it just enables you to view it whenever it suits, really.
Thank you.
Thanks, Nigel. So then on the second screen relating to each priority and set of commitments, you'll see at the top there again we have the priority highlighted that we're dealing with. And again, the council plan commitments, but this time you see the detail presented is the more of a narrative description of the progress that's being made against each item. Thanks, Nigel. And again, you've got those selection buttons there for the dashboard when you receive it. So then to pick up on the second tier of the hierarchy, performance measures, this deals with the departmental strategy level, and the focus here is on the 4 departmental strategies. Now those do represent what the council's direct contribution is to achieving those council plan commitments, and that's through the delivery of its services. 6-monthly progress reports are generally presented to service committees on these, along with quarterly updates against the core data sets that drop out of those strategies. COVID-19 had disrupted that reporting system, but as set out in paragraph 9 of the report, that just sets out where we've got to in terms of some of that activity now resuming, and it's been around the reporting of the core data set so far. So we would normally, as part of this report, summarise how well the council is delivering its own contribution, but on this occasion, because of COVID, there's just not been sufficient data available for us to do that. So then to bring all of that together in the table and the main report, and again, just to walk members really through what we're looking at here. So again, on the left-hand side, you have the council plan commitments displayed. And then in the middle column there, you have the overall summary really of what those council plan commitment, what the measures are telling us around progress on those high-level data sets. And then on the right-hand side, we have a summary of the narrative progress against the actions. That space would normally be reserved for reporting how well each departmental strategy has been progressing, but as I say, that's yet to resume yet. Thanks, Nigel. And then just a word finally about the Chief Executive's Department. The focus here is more on the 5 core approaches in the council plan. So these are the things like spending money wisely, standing up for local people, that sort of thing. And the progress reporting on this is it goes on across a range of committees during the year, and Appendix 2 brings together a summary of all those programmes of work and the routine activity that has gone on progressing around those 5 approaches. And much of that is relating to the work of the Chief Executive's Department. And that's summarised in paragraph 12 of the main report. Just finally say, Chairman, we do have representatives on the call from most of the departments, Hopefully that can help with any particular questions that people have around specific services. Thank you, Chairman.
Thank you, Rob. Thank you for that detailed report. And just going to go to the recommendations. The Improvement and Change Subcommittee considers the progress outlined in this report and determines whether any actions are required to further scrutinise any aspects of the Council performance. And do I have a seconder for that, please?
Yes, Chairman, it's Councillor Cotty, and I'd second that recommendation. Thank
you, John. Thank you very much. And now I'll take comments. Can you just raise your hand? I think it's easiest for me. So the first one is Councillor Diane Meal, right? So Diane.
Yeah, I'm here. Thank you, Chair. Just to say, I really welcome the increased clarity that this brings on this reporting. Obviously, because of COVID, we haven't been able to do all the reporting that we would like, but the clarity is great, and I look forward to be able to interrogate the system myself in terms of flipping through stuff. Very, very helpful. Thank you. I just have one specific question, which is on the yellow pages, priority 2, Nottinghamshire is a thriving jobs market. This is at the bottom there, number of people supported by council in apprenticeships and placements related to social care and public health. Clearly there has been a whole issue around ensuring that people who need support and care continue to have that care with a workforce that is well trained in the future. Well, currently and in the future. And in the report, it does say that there has been quite a bit of success in recruiting people, but clearly this hasn't at the moment, although the previous value for apprenticeships relating to social care and public health was 26, it's now down to 12. I don't know when this relates to, the measurement relates to, but clearly if it was post-COVID, it might be a COVID issue in terms of apprenticeships, but I'd just like a little more clarity about, you know, why there's been the drop off in the number of apprenticeships that's shown here.
Okay, thanks, Diane. Next, I've got Kate.
Thank you, Chair. Thank you. Yes, and you know, as Diane said, thank you for the very detailed report. It is a much improvement. It is still readable. I think there's still a little way to go in terms of clarity, but it's certainly getting there, and it is much better than it was. And again, I have one or two specific questions. I wonder why this is paragraph. Paragraph 12. Why the council is still pursuing an opportunity to present proposals for unitary government. Given the Secretary of State's rather robust response to that, I'm not sure why that's in there, and still potentially mopping up, wasting a lot of time and officer time and money. Okay, but secondly, in the yellow pages, there is a couple of things I wanted to raise, if I can find them. Okay, priority 3 in the yellow pages, mention of timely hospital discharges. And I raise this because wonderful that discharges are being made in a more timely way. I think we'd all agree with that. But I'm aware that there was significant concern about some discharges that were made very quickly around the COVID crisis, which I'm told resulted in some elderly people going into care homes without being tested for COVID. So I just wanted to check to make sure that that was actually happening, but of course it was happening safely. And one last thing, I think, yeah. Again, question about Nottinghamshire schools suggests that disadvantaged children have been disproportionately affected by the pandemic. Any insight in that? I'd be, because it's something I'm a governor of several schools and it crops up a lot, and I'm just very concerned that actually our disadvantaged pupils are going to be even further behind, and whether, to what extent the local authority is helping to support schools to try and get around that one. And just a thank you to the youth service. I've had 1 or 2 briefings now with the youth service, and I had some anecdotal evidence that the youth service has been redeployed. It's been working in lots of different settings very effectively, and very flexibly. And I think that's a really fabulous example of the council actually redeploying its staff in a really meaningful and sensitive and creative way. So thanks to the youth service for that. It's me done. Thank you.
Yeah, thank you very much. And David Martin.
Morning, everybody. Thank you, Chair. I'd like to be as constructive as I could be, but I'm afraid it's a big exercise in spin. There's lots of figures, massive amount of figures baffling the science. Whilst it acknowledges that due to coronavirus, we're working in challenging financial environment, it also ignores some of the obvious metrics to check against service delivery. I'll give you an example, Mr. Chairman, there being a significant rise in preschool dinner claimants in our county since the middle of March. They've gone up 35%. The number of children claiming preschool meals in Nottinghamshire has increased by more than 3,000 since the start of the pandemic. This is according to the latest data available from yourselves. This shows a large rise in all districts and boroughs, not least like Ashfield and Mansfield. The area hardest hit by the increase is in Ashfield, where the number rose from 4,187 to 4,825 in just 7 months. But areas have also seen sharp increases, with rises also recorded in more typically affluent areas like Rushcliffe. This shows the reality of the situation we're facing with child poverty, Mr. Chairman. So my question is, was this, of the 16 measures in the report, was this one of them? Moving on to the chart on page 8, commitment, people are healthier. So during the coronavirus lockdown, this council, on advice from the police, stopped proactive action to stop illicit smoking. This was confirmed at a recent meeting of the Social Care and Health Scrutiny Committee. So how can this council claim to have continued success to stop illicit smoking, coupled with the sale of it, when it's patently not the case? What figures can this council produce to substantiate that? One thing the report mentions is value for money for the taxpayer several times. I'd like to look at 3 of the 5 approaches to the guide for delivery of services via the council's plan. Put local people at the heart of everything we do. The report states, for the long term, the council is pursuing an opportunity to present proposals for unitary government in its administrative area that would be focused on the ongoing engagement of residents. The council is spending £100,000 on such a loaded consultation, local government reorganisation. The words value for money enshrined are an absolute joke. Can I see a report on how this money is being spent and what the results are? The reality is that local government reorganisation is not going to happen anytime soon. Yet this council persevere in trying to make the case, and when it's clear there's no public appetite, no real member appetite, and I include members of the Rushcliffe Conservative Association in this as well. So whichever person becomes the leader of the opposition of this next authority, we'll have to stop committing to spending on these plans, and we all know this.
Okay, David, we don't need to elect you. Can you just stick to the points and stick to the report?
There are questions in there. There's also a commitment to be creative, to work in new ways. One thing the coronavirus pandemic has shown is that the council can work smarter. So our army of brilliant staff are already working in new ways. Many of them are working from home, yet this council is continuing to build £28 million worth of new buildings to spruce up others as well. Is this really value for money? Finally, Mr. Chairman, the report mentions the annual resident survey of 2019 and the fact that it returned positive outcomes, that the overall satisfaction levels remained high. How many residents engaged in the process and how? Do you have the results split up into borough and district areas? What does the phase standing up for local people actually mean? A simple look at the highways programme spend per area shows that this is not the case. Standing up for Rushcliffe, maybe. Standing up for Newark and Sherwood, definitely. This council doesn't certainly stand up for the poorest areas like Mansfield and Ashfield. This report is conjecture. It fails to address the most important issues that faces, and it's these, Mr. Chairman, that I cannot support. and it's so far detached from reality.
Okay. Thank you, Councillor Martin. Councillor Philip Owen.
Yes, thank you, Chairman. I'm not going to read out a pre-prepared speech like Councillor Martin, but I think there are a number of points that I need to make in response to what has been said by one or two people. Councillor Fole was asking what we are doing as far as disadvantaged children are concerned. I would refer her to the answer that I would have liked to have given at the last county council meeting, where I was asked a similar question by two members of council. I have published a very, very detailed response, and that response has gone to Councillor Peck as the opposition spokesman on Children and Young People Services, and I suggest she asks him for a copy of it. I assumed he would have circulated it to her, and there she will have a very, very comprehensive list of what we are doing as a county council to support all pupils in Nottinghamshire during this difficult time, and in particular those who are disadvantaged. It's a pity I couldn't get round to that question. I had intended to answer it in part and then publish a separate detailed account, but that is available there, Chairman, and I refer her to it. I certainly agree with Councillor Fole that the youth service have been doing an incredible job. They have been extremely flexible. They've been supporting vulnerable children, and they've been helping in our county council home settings for vulnerable children, for looked after children, amongst other things. And that's why we have sought to protect the youth service from any budget reductions, unlike the previous administration, of which Councillor Fole was a leading member, who decided that the youth service wasn't worthy of protection, and decided to make cuts across that service. Councillor Martin read out about free school meals. Well, I think he's failing to understand the situation. There is a difference between eligibility and claiming. I welcome the fact that more parents whose children are eligible for free school meals are actually claiming them. I mean, what we've had in the past is a reluctance on the part of a significant number of parents whose children would be eligible for those meals, free meals, to claim them for whatever reason. The fact that more of them are actually claiming them now, I think, is something to be celebrated, because it means that they will be getting good quality meals at lunchtime. And I would point out, Chairman, that we are supporting, or we did support during the October 2-week half term, and we've pledged to support during the Christmas holiday over 22,000 children to secure them free school meals through whatever system the school puts in place. So I think that is to be welcomed rather than criticised, and it's a complete failure to understand the dynamics of the free school meal situation. And it also enables schools, Chairman, to claim pupil premium monies as well. So it's a win-win situation. As far as local government reorganisation is concerned, I'll just mention in passing, well, Councillor Fole is clearly, or Councillor Martin, are clearly celebrating the fact that £27 million per annum is going into supporting a two-tier system rather than going into supporting frontline services. That's not something that I wish to celebrate. Can I just pick up on a couple of points which I'd intended to make, Chairman, before I felt it necessary to respond to what has been said. On page 4 of the report, 8 of 98, we've got children and young people go to good schools. We have 3 secondary schools there that are deemed inadequate in Ofsted categorisation. Can I just remind members, although you probably don't need any reminding, that, of course, all but one of our secondary schools are academies, and we have no direct responsibility for academies. I can assure you, and I can assure members, behind the scenes that officers work very closely with the Regional Schools Commissioner, who does have responsibility to drive improvements in those schools forward as best we can. But unfortunately, we don't have any direct responsibility. And then just lastly, Chairman, turning to the next page 5 of the report, or page 9 of 98, Nottinghamshire has a skilled workforce for a global economy, and we report there that the percentage of the population remains below target, and this is disappointing. But of course, a lot of this will be delivered, or should be being delivered, through colleges of FE. And I have to say, we are not well served at the moment uniformly across the county. One college in particular seems to have been more concerned in closing its satellites and centralising in Nottingham City, rather than getting out there and delivering the quality courses that we desperately need for our young people if they are to succeed in a global economy. And it's a great pity that we don't have control over the skills agenda in the East Midlands. Again, something that would come with local government reorganisation. So with those few comments, I thank you, Chairman, for letting me contribute.
Thank you, Philip. Councillor Jim Creamer.
Thank you, Chair. I do have just one simple question. I hope it's simple, but just to respond to actually what Kate said about the reorganisation of government and Councillor Owen's response. We actually do feel that it is a complete waste of time, and particularly Owen's contribution at the moment, where we're working with partnership, and he's busy there putting the boot into local government, i.e. district councils and boroughs. So on that one, and could I actually thank Councillor, he's absolutely correct in his free meals quotes about get this right, ability to claim and actually claiming. It's just unfortunate that the government policies at the moment are creating more families that are able to claim. So Councillor Martin is quite right in his question, and Councillor Owen is trying to mislead it. But my actual simple question is, and it is, being as you've put these figures together during COVID and you've brought it up to September, are we going to receive a separate report cutting that section out so we can see how effective this style of reporting is during a crisis period? So it's as simple as that. Are we going to get another report, but broken down just to the actual COVID period, or 2 COVID periods in this case, to see how effective this new style of reporting is? Thank you, Chair.
Thank you, Jim. Councillor John Cotty.
Thank you, Chair. I'm just going to follow on from Councillor Owen's comments, where he mentioned that Councillor Martin fails to understand, because he does fail to understand on the highways question. He doesn't want to know a different answer, because they're pumping out in their areas the political side of, we're not spending the right amount of money in Ashfield. So he's going to get the answer from me that he's already had before, and his colleagues have. There's no point of order.
Councillor Martin, can you take your hand down? Councillor Cotty speaking.
Yeah,
Councillor Martin, take your hand down. No, I'm not letting you in. Councillor Cotty speaking.
This is not
he didn't interrupt you.
This is not
I didn't interrupt you, Councillor Martin.
Other councillors. This
can
is a debate
we Councillor Martin?
Not a debate to castigate other councillors. Thank you, Chair.
So what is your point of order?
This is a debate about the paper and not to castigate other councillors for their opinions. It's a political arena. We are all entitled to our own opinion. I thank other councillors for sticking to the point. Thank you.
Yeah, but let other councillors speak when they're speaking, please.
Thank you for interrupting me, Councillor Martin. I didn't interrupt you, and I'm going to continue with what I was saying. You fail to understand. Councillor Owen made that comment. You're just using it for political gain when you know full well that your take of it is that you don't get as much money as Rushcliffe for the highways. So I'm going to tell you again on a meeting that's recorded. So when you forget in the future, you can come back again and have a listen. You have 10% of the roads in Nottinghamshire in Ashfield. You have had every year at least 10% of the funding that we have available.
We're not here to debate the highways budget.
Well, you were debating highways and the budget.
As an example.
Well, I'm using this as an example. Thank you, Councillor Martin.
Can we move on? We're getting into a discussion that's not applicable to this.
Political forum to castigate somebody else for their opinion. Rushcliffe got £2.4 million more than Ashfield this last year.
So you're doing the same then, are you, Councillor Martin?
Density of population is why Ashfield is smaller. Our roads get used three times.
Can you take this discussion to the Place Committee, please?
Well, that's what I said, but you let him carry on. So,
okay, John, are you finished or are you wind up?
Well, there's no point because he's just going to keep coming back and arguing and interrupting, Reg. So I've made the point. They've got 10% of the roads, they get 10% of the budget. It's not about population, it's what the government say we have to do. That's what we do.
Okay, John, thank you.
Thank you.
And Councillor Kay Cutts.
Thank you, Chairman. I just want to talk about the Improvement and Change Committee that we're on at the moment, because, of course, this is about improving things, but also changing it. And if you're going to change something, you obviously don't want to stay the same. And therefore, I think it's quite right that we do look at local government reorganisation. For the most of the country, that is no longer a system which is used there. It is expensive. It is a waste of time, a lot of the time, toing and froing, and really doesn't add very much to the value for people who are the electors here. But also worse than that, they actually pay for it. So I think we have a better duty to respond to them. And the other thing I'd like to refer to is the extensive programme we have of making our buildings carbon neutral as far as possible, and also making sure we have buildings in the right place for the right job, because there's no point in having unnecessary car journeys made for people to travel to a building which is in the wrong place. And therefore, I'd have thought that in an Improvement and Change Committee, it's incumbent upon us to examine all of those things and make quite sure we do have them in the right place. So I simply say to anybody who thinks they're going to vote against this, just remember you're voting against carbon neutral, you're voting against change, and you're voting against any organisation that may be different than it is today. So why sit on the committee? You may as well go and sit in another committee which is perhaps more to your taste and your liking. I do take the point that Councillor Cottis made. I think all of the district councils get a fair share of the funding. It's really important we do make sure of that, because it's not a political weapon, never has been and never will be whilst the Conservatives are in charge. And if the Ashfield district get 10% of the funding, the 10% of the roads, that strikes me as being absolutely fair and equitable. And therefore, it's really important that we do make quite sure that all parts of the county are treated fairly and equally. But we can't stay the same, which is the whole point about this meeting. We have to change the way we do things. We have to make sure we're fit for today's purpose, that we're serving the people who elect us. And this is an opportunity to debate these things. But being in denial isn't going to help anything. And therefore, I can only suggest if no one wants to change anything, they probably should not bother with this committee at all. But, you know, we've had some very constructive debates this morning. And I do think it's incumbent upon all of us to try and work together to make improvement, to make change to our council, but also thinking the unthinkable. And if it's something you find uncomfortable, well, then as politicians, we ought to be made to feel uncomfortable from time to time to deal with the situations we're in. Nobody wanted a pandemic. I think this council has worked really well to the pandemic. We made quite sure we put money in the right place for the right reasons, and we have responded to it. But it couldn't have been built in February this year in the budget, because none of us knew it was going to happen. So we have to be swift of foot as well. And I think using all the council's resources to try and serve the people of Nottinghamshire is what we should be doing. So thank you, Chairman, for letting me speak.
Okay, thank you, Kay. So, officers, that's all the members' comments. So who would like to respond to some of the comments that haven't already been responded to? Rob?
Yeah, if I could perhaps just fill some of those gaps. I think Melanie Brooks would like to pick up the questions that Councillor Meal and Councillor Fole raised. Okay,
so are you going to go first, Rob? And then I'll bring Melanie in.
Yeah, I think probably one for me was from Councillor Creamer. I think was about the format of this report. I thought that was a helpful point to raise, and it's something that I think we could certainly look into, making sure that I think we always want to make sure that the format of this report meets its purpose, and I think it is something that I think, as Councillor Fole pointed out, it has developed since the previous versions. The point about COVID, I think, is a good one, and I think probably in paragraph 9 of the report, I think you can probably see there that some of the departments are thinking about the impact of COVID and what that means on their measures as well. So I think it's a sensible suggestion, and I think that's one that I'd like to take forward and look into. Thank you, Chairman.
Apart from any other officers apart from Mel want to say anything? Okay, Mel, I'll bring you in.
Morning, Chair, morning, members. So on item 5 today, I am going to be talking through the impact that COVID has had on both public health and adult social care and our redeployment of resource and effort into that. So you'll be hearing from me in detail around that. But just to answer some of the specific questions. So first, Councillor Meal, thank you for your attention to the apprenticeships in adult social care and health. We are very successful at supporting in the graduates and apprenticeships into the general services. The bit that we paused and that we're now just standing back up is the social work and occupational therapy apprenticeships. So that's mentioned in my report I can't remember which paragraph it is. I refer to it when I'm presenting, but the workforce remodelling we paused from March to September. So those apprenticeship roles were paused for that period. The other item I pick up in my report is the employment and health programme. So again, we've had to pause that. And unfortunately, because of outbreak management takes up all of our capacity, we're pausing that indefinitely until we recover from COVID. So we've been in emergency planning right from March till now. So we actually haven't had 2 periods of COVID. We've had 1 period of COVID and emergency response, so just for that clarity. So hopefully that answers the question there, Councillor Mill, but do let me know if I haven't answered that. I also wanted to pick up Councillor Fole on the issue of safe discharges. So we've had quite a lot of discussion at Adult Social Care and Health about this, and you'll see the winter plan that we published at the end of October clarifies that. So it's government guidance about safe discharge and the requirement to have a test before being admitted into a care home. And we have a weekly report that we submit to the Department of Health that tracks any discharge that hasn't had a COVID test. And we have had, so for every discharge since April into a care home, everybody's had a COVID test. So I've got absolute assurance on the safety of discharges, just to give you that. And then the last point, Councillor Martin, we discussed this at committee about the illicit trade of tobacco and the police decision to transfer their resource into COVID measures enforcement away from the illicit tobacco trade. And I believe that we said that we would have an update from the police, and I'll just need to check back in with Councillor Harper and the administrators for that committee as that response. But if you recall, that was a police decision about their emergency response made and where they direct their resources rather than a public health decision.
Okay, all right. Any other officers want to add anything? No. Okay, then thanks for that. And shall we go to the vote on the recommendations which have been moved and seconded? So in order to make the voting clear, each agenda item, I will ask Sarah to read out members' names alphabetically in order for them to confirm whether they're voting for or against the recommendations or abstaining. Thank you, Sarah.
Thank you, Chairman. So please note that the Okay. Please note that the individual votes today will not be recorded in the minutes of the meeting unless 2 or more members request it, in line with the usual recorded vote arrangements. So I'll read out the names in alphabetical order. Councillor Adair.
4.
Councillor Cotty.
4.
Councillor Creamer.
4.
Councillor Fole.
4.
Councillor Harper.
4.
Councillor Jackson.
4.
Councillor Martin.
Against.
Councillor Meal.
4.
Councillor Owen.
4.
That's 8 votes for, 1 vote against, so that's carried, Chairman.
Thank you, Sarah. Thank you for the vote. So we move on to agenda item 5, which is transformation and change programs and the transformation model and structure. And I go to, who do I go to for this report? I go to Derek Hickton is actually going to do it. Thank you. Thanks, Derek.
Thank you, Chairman. Good morning, members. So I'll just walk you through a summary of this report before opening it up to questions. So the purpose of today's report is really to update members on the development of a number of cross-cutting council transformation programmes that are designed to improve outcomes for residents whilst enabling the council to meet the financial challenges that we're all very well aware of at the moment, and also to seek approval for a proposed high-level structure for the council's transformation, improvement and change function. This report builds upon several reports that have been put in front of this committee over the summer and early autumn of this year. So if I move on to the actual transformation and change programmes that we're describing within the report today, as I say, this report sets out 4 new cross-council programmes. All represent significant areas of cross-council activity across a number of the council's departments, and each of them represents significant opportunity to both improve outcomes and the council's efficiency, hence our proposal of them today. The programmes themselves build upon the work that we undertook with Newton Europe earlier on in the year, and they will all sit alongside and complement the council's existing corporate programmes. An example of that being the Investing in Nottinghamshire programme around building development and rationalisation. And you'll see from the report that each cross-cutting programme will be sponsored and directed by a corporate director, both to ensure that it's got appropriate priority within the council, but also to ensure effective visibility across the council as well. And you'll see in paragraph 7 of the report that I've outlined within it each of the 4 programmes and provided a little bit of supporting detail. The first programme being all age approaches to improving support for those with disabilities. That obviously is an area of activity that takes up a significant amount of resource and officer time, both within, in particular within adult services and within children's services. And the proposal for the programme is that we take a whole life course approach to the council's provision for those with disabilities and for families affected by disability, so that we can focus across the piece on improving outcomes, minimising risk factors and enhancing protective factors through the delivery of better interventions at key stages throughout the lives of our service users, and their coordinated interventions as well, so that our departments work more effectively across those departmental borders than perhaps has been the case in the past. And that programme will be directed by Melanie, Corporate Director for Adult Social Care and Health. The second programme is developing integrated prevention and early help interventions, and that's an area where we wanted to build upon a lot of the work that we've done directly in response to the COVID pandemic and the development of our kind of community hub, which has been really successful in supporting the food and the support needs of many vulnerable people across the last few months, and is very much based around an increased relationship between the county council and our community, voluntary and district council and borough council partners. So this programme wants to build upon that and also think about how, in respect of the remainder of the council's early help and prevention provision across all of our departments, how we might better engage with, work with and support those community-based services and support groups to improve access to services and to improve the delivery of early support for residents, with a view to hopefully reducing demand for higher cost and higher level interventions, particularly in children and adults in the future. And this is a programme that will be developed and directed by the Corporate Director for Place, Adrian Smith. The third programme is developing whole family approaches to safeguarding. So this is an opportunity for the council to coin a phrase, to think family around safeguarding provision to support vulnerable children to achieve improved stability and safety, well-being and educational outcomes through a much more joined up approach across all of our council services, but also with some of our critical partners, including schools and health service partners too, so that we can work not just with children, but with the whole family to build on the strengths that exist within families and to address the risks that often exist within those families too. And that's a means by which we hope to be able to exert some control over the long-term high cost demands for children's social care that we see in Nottinghamshire and nationwide and have done for a number of years now. And naturally enough, this is a programme that will be directed by Colin Pettigrew, the Corporate Director for Children and Families. The fourth programme is improving residents' access to services, and this is a programme designed to drive the further development of a coordinated and integrated council front door, if you like, based around our really effective customer services centre, and really strengthening our approaches to digital service provision and self-service for residents where they can self-serve when they need to access council services and information. We're looking to incorporate within this programme a review of our multi-agency safeguarding hub as well, because that represents our second, if you like, call centre that we own and operate. And therefore, this programme will be directed by the Service Director for Customers, Governance and Employees, Marge Toward. We're looking for this programme to also incorporate a broader review of our general approach to digital development and our corporate systems as well, so that we can ensure that across the piece, all of our corporate and digital activity is driving in the same direction to support both the council efficiency and effective cross-council activity. There are a couple of underpinning strands of work that I'm describing as well in paragraph 7, and they represent or are summarised as being a workforce design programme, again sponsored by Marge Toward, to enable staff to have the skills and capabilities that they need to move into a different way of cross-council working in the future, and a strategic commissioning programme sponsored by Melanie Brooks, because so much of our corporate level activity now and our service provision is driven through commissioning, both internal, partnership and externally led commissioning as well. So that describes our kind of overarching corporate programmes, our new programmes. Paragraphs 8 onwards describe and build upon previous reports of the committee, where we've set out a new model for transformation and change that members have previously approved. And paragraphs 9, 10 and 11 describe the 3 key elements of that new transformational model. The first being a strategic insight unit that will, for the first time, I think, ensure that the council's approach to transformation and change is very much led by data, research, policy and strategy and business analysis, and will ensure that we've got a corporate heart for that kind of work sitting in the centre of the council that will support departments and also offer a little bit of challenge to departments and to services as well, in terms of developing new ways of thinking, new ways of offering services, and ensuring that we've got effective data analysis to support new ways of working and measuring whether they're successful. The second element is a transformation and change bureau, which is the home, if you like, the corporate home of all of our project and programme change managers. They'll be within departments, but that transformation and change bureau will provide them with a professional home, if you like, and it will provide the council with the ability to ensure that those staff have got a consistent skills base, a consistent approach, and are effectively supported in their efforts to support and drive change within departments and across the council. And the third element is a transformation and change portfolio office, which will offer light touch governance, monitoring and tracking of the use of resources, and will also challenge the council and departments to drive out the benefits that we will need, both in terms of service improvement and in terms of financial benefits through the delivery of our programmes. Now, in order to deliver all of that activity, we'll need to restructure the transformation and change team, and paragraphs 12 to 14 describe how we're proposing to do that, starting with a high level restructure at team manager level that will establish a number of new posts, and will also ensure that this work fits with the remodelling of the work of the council's data management team as well. Paragraphs 15 to 17 describe how our cross-council work and our new transformation model will fit with existing service improvement and change activity, so that we can ensure that all of that activity across the council, both major change and service level change is coordinated, effectively managed, effectively governed, and delivers both service improvement and financial efficiency where appropriate as well. And the final part of the report describes the next steps that we'll take both to enable into the 5 key posts that we've described within the report and the process that we'll go through to develop a consultation process and the detailed team structures that will then bring back to a forthcoming subcommittee meeting for approval. So just to sum up, the recommendations are that we approve the proposed high-level structure for the transformation and change and data management teams and the development and consultation on full structures for both teams, and that members agree to receive further updates on the implementation of the transformation model and the definition, initiation and delivery of the Council's transformation programmes at future meetings. Happy to take further questions from members.
Okay, thank you, Derek. So I'll just go back to the recommendation. It is recommended that members approve the proposed high-level structure for the transformation and change and data management teams and the development and consultation of full structures for both teams for approval and improvement and change subcommittee at a forthcoming meeting, and agree to receive further updates on the implementation of the model and the definition, initiation and delivery of cross-council transformation programmes at a future subcommittee. I move that recommendation. Do I have a seconder?
It's Councillor Cotty, and I second that recommendation, Chairman.
Thank you, John. And Councillor Jim Creamer for a comment.
Thank you, Chair. Just had to unmute myself first. Yeah, just a general question. Can you hear me?
Yes, we can.
Yes. Just on the Strategic Insight Unit, page 29, 9, bullet point 2. A focus on research, policy and strategy keeps abreast of national thinking. Just for clarification, because there's a lot of management speaking this, who's national thinking, what national thinking abreast of? And just that goes along with the Change Bureau and other elements of this, is there a specific training budget in for all these transformations and changing of staff's duties? Because a lot of the change will actually incorporate people changing roles or doing extra roles, etc. So is there a specific training budget anywhere in this applied to make sure that we keep on top of it? Thank you, Chair.
Thank you, Jim. And Diane Meal.
Thank you, Chair. Well, partly I welcome the ambition to look cross-council. These are some really crunchy issues to tackle. So I really welcome that, you know, we're thinking about tackling some of these really crunchy issues across, in particular, sort of the adult social care and the children's and adults children's services. I just have a question about the finances. So at paragraph 20, we're talking about the consultation process around the team structures. And we're saying that detailed structures and their financial implications will be brought to a forthcoming meeting of the subcommittee for approval. And in the financial comments on page 33, it's saying that there are no specific financial implications arising directly from this report. I can understand that. And that we're being asked to, in the recommendations, approve the proposed high-level structure of transformation, change and data management teams and the development and consultation on full structures for both teams for approval at a future committee. So I'm just gathering from this that we really don't know what the financial implications of these staff changes are. Have we got any indications what they might be? You know, have we? Yes, I just wanted to know if there's any more information on that.
Okay, thanks, Diane. Councillor David Martin.
Yeah, thank you, Chair. On the whole, I find the report very conclusive and interesting. And whilst I recommend welcoming the fact that the council's prioritising improving life chances for disabled and most vulnerable, there's not really a lot of meat on the bones in the report itself about how you achieve that. because the record of this council is not great in that area. You know, we've only recently axed 3 Sure Start centres in the county, including All Saints Children's Centre in Huthwaite. Does this council really value the work that our children's centres do? Do they understand why they're there, where they are? And it's ensuring a whole family approach to safeguarding provision. As part of this, will the council commit to funding children's Sure Start centres as a strategy? Because even in Ashfield, to go to the hub system that Birmingham City are alluding to would make those Sure Start centres almost unreachable by most of the residents, and I would presume if they're needed in Rushcliffe and Newark and Sherwood, then that would be even worse because they're spread over a larger geographical area, as has recently been alluded to. So you know, I just want to put a bit more meat on the bones about the actual strategic plan for that. Thank you.
Thank you. Councillor Kate Fall.
Thank you, Chair. I share a lot of the concerns that have already been made. I think it's a good report, and it's good that we're looking at ways of transforming and changing policy. So I think so. Thank you to Derek and officers for putting this together. I do have concerns, though, I'm afraid, and some of them I share with others. Going back to Diana's point, the financial detail is very sketchy. We're being asked really to agree on a report that really we don't know how much it's going to cost. And that's not something as a responsible council I really feel that that we can do. And again, I agree with David Martin's comment about detail. And okay, fine, you can't have masses of detail in a report like this, but it's so high level, it's really difficult to actually understand how some of it might work. I'm worried as well that it has come to this committee and there's no, and later on it says that a further report will come back to this committee. This is a massive change. It's something we all ought to be on board with. It ought to go to full council or policy committee at the very least. So I would make a plea to kind of do that. Specifically about stuff in the report, I just worry a little bit about some of the wording, some of the emphasis on the report. I'm looking now at paragraph 7, the all age approaches paragraph at the bottom of there. It's talking about may deliver improved life chances and help manage reduced demand for more expensive provision. I hope this isn't all about the money. That's really what my concern there. Clearly, we've got to make costs. I do know that, but please not at the expense of service. The community hub, or the developing integrated provision and early help interventions, absolutely right. The community response has been fantastic, and just thanks to the wonderful communities in our wonderful county for actually stepping up and actually giving a lot of this support. Now it's fantastic, and the idea of actually kind of engaging better with those is really good, and one that I absolutely would support 100%. But I hope this isn't going to be massive reliance on volunteers, and I hope if we do engage with them, that means we give them the help, the support in terms of skills, building, and the funding to make it happen, so they can actually do it and make a success of it. I think we can. I think it's a good idea, but I just think we need to recognise the funding and the time restraints on our people who are helping out in the county in such a wonderful way. The whole family approach to safeguarding, brilliant, and residents' access. Just one thing that is a permanent beef of mine. It's under it's at the top of page 29, the underpinning strands. It talks about the last sentence in that section to provide effective strategic commissioning and secure cost-effective outcomes. Please, can we proactively try and engage our local business? I know we try to do it, and it's in all our procurement strategies. I'd like to see a bit more evidence that actually it really is happening in a meaningful way. My other big concern I have, and this is with great respect for Derek, who seems to have about 12 jobs, there's mentioned here about capacity under item 10. And I just really wonder, this is a massive piece of work, if we really do have the capacity to do that. I know there's talk a while back of another director in charge of transformation change. And again, with great respect to Derek, you can't do everything. How is that progressing? I think, but again, going back to what Diana was saying, and this is the crux of a lot of it, financial comments, there are no specific financial implications arising directly from this report. That's not clear enough. Thank you. Okay,
thank you, members. Derek, would you like to respond to that?
Thank you, Chairman. Thank you, members, for those questions. I've made a note of all of them, I think, but no doubt if I miss an answer off, you'll be able to point that out to me. So I'll take them in the order that they were asked. Councillor Creamer, you asked a question about the Strategic Insight Unit and national thinking, and what does that mean? I think it means national level research, national level understanding that's developed through the local government sector, through government, and through partnerships with some of the private sector organisations that support and work with local government as well. So I think it's a bit of a catch-all phrase that captures all elements of national thinking around policy development, the direction of travel for particular services or for local government more broadly. It's a broad term rather than a narrow one, if that makes sense. You asked a question too around will there be sufficient training for staff to support that kind of move into a different way of working within the new transformation and change model. And yes, there's a training budget that will allocate for that to enable that to happen. Councillor Meal, you mentioned that some of the issues that we're dealing with here are crunchy, and I absolutely agree with that. They definitely are. But your question was really one around kind of the financial implications. It's the case that for the financial implications for this report are very much focused upon the direct implications of the implementation of the high-level staffing structure that we cover in the report and the establishment and the recruiting to the 5 key posts that we've identified. That will be done within existing resources, i.e. the posts that are already devoted to those posts, hence the fact that there are no direct financial implications. In terms of the direction of travel for the broader development of the detailed structure for the whole team, that will be the financial implications will be picked off and covered in the next report that we bring to committee, but that team will be delivered within the existing resources that are available to us as a council. So my intention is not to establish a team that requires more corporate resource than that which is currently devoted to the team, if that's helpful. Councillor Martin, you asked a question around the cross-council programmes, and you rightly pointed out that what we've provided for you is a high-level summary of the programmes themselves. That's absolutely the case. What we've committed to in the report is, as we develop the cross-council programmes, and they're all at a very early stage at the moment, we've got to move them off the page, if you like, into real activity and real work. And as we develop that work, we'll ensure that we bring that developing work back in front of this subcommittee and members so that you can consider it and comment and help us work with us to shape what that work looks like. But the programmes are at a very early stage at this point. So what we don't have is masses and masses of detail yet behind that. We're developing that at the moment. You asked a question around the kind of broader commitment to children's centres. That's a matter for Children and Family Services colleagues in terms of the detail of that. But the early help and prevention cross-council theme that we're developing will absolutely look at how we can ensure that both from an early years through to an adolescent and then through into the mature and adult phases of residents' lives, we're able to take a holistic approach to supporting both individuals and families so that we can we meet the in an early help sense the challenges that they're going to face throughout their lives. And Children's Centre will certainly be part of the conversation around the early help and the prevention work stream. Councillor Fole, you asked a couple of questions around finances and detail, which hopefully I've kind of picked up there. In terms of whether or not this is the right committee, that's always a matter for debate. But when we when we prepare every report, we take advice from our legal and democratic services colleagues on whether the report is which committee is the most appropriate place for the report to be considered. And our advice on this occasion for this report is that this committee is the appropriate place, given the terms of reference of the committee and the nature of the report. In terms of kind of change, you ask a question around whether the change is all about money, and that's something that I've been very conscious of in developing the cross-council themes with colleagues for a number of reasons. Because what we can't do is develop change programs that are all about just saving money, because that tends to lead to programs that aren't effective if we just focus on funding for a number of reasons. And a key one of those reasons is that it's very hard to engage the support of staff and stakeholders in programs of change that are all about saving money. We don't come to work to save money. We come to work to deliver public services and improve outcomes for the people that we work with and work for. And so, as well as delivering efficiencies and savings, we have to find ways, new ways to innovate and deliver better services as well. So what we're looking for here is to deliver better and cheaper services. This council's got a really good track record over the last 10 years of doing just that at a service level, and what we're wanting to do is to extend that principle to cross-council activity as well. So absolutely, from an officer perspective, it is not all about saving money. It's about improving lives and saving money. And you made the point about the potential to over-reliance on volunteers in the as we look to develop the community hub. Absolutely, that's a danger that we need to be aware of. Volunteers do things because they enjoy it, they get something out of it, not as a substitute for local authority or statutory services. And that, I suppose, links back to my previous point. We've got to be absolutely wary around putting too much pressure and emphasis on the work that our volunteers and our voluntary sector does. But there is scope to look at how we can strengthen that relationship and strengthen our support for them so that perhaps their capacity is extended and improved in the future. You made a strong point around the engagement of local businesses in our commissioning activity, and you'll have heard recently, I think, at Policy Committee about the good work that our key property supplier ARC does in that respect. And absolutely, as we develop our strategic commissioning programme, we'll be looking to strengthen where we can within kind of procurement and legal boundaries, the work that we can do to support our local SME community. And you ask a question around capacity and the appointment of the new service director. I'm aware that currently consideration is being given to recruiting to and advertising this post on a permanent basis, although I'm not clear yet about the precise timescales for that. But given that this will be a member appointment, and we're now rapidly approaching the period leading up to the local elections in May, I suspect that might be an appointment that in the end is made for practical and diary reasons after the local elections. But in broader terms around capacity to deliver on the cross-council programmes, we're obviously at a bit of a pinch point at the moment and have been for a while now, because of COVID and the need for us to prioritise our response to that from an officer perspective. So we're giving consideration at the moment to the pace with which we develop and roll out the cross-council programmes, because it may be that we can move a little bit quicker with some areas of the work than we can with others, because of the particular pressures that are placed on colleagues, mainly in adults, but also in children's services as well. So the cross-council programmes that will require very active engagement, involvement and leadership from a children's and adults perspective, we might have to think a little bit about how we manage the pace of that as we start to contemplate being able to come out of the COVID response and back into the recovery phase that we were in over the early and mid summer. So capacity is an issue for us. It's bound to be an issue for us, but it is one that we're actively addressing. In terms of the capacity of our kind of corporate model to support the new programmes. I've got no concerns that we won't be able to support the delivery and the programme management of those cross-council programmes, because that's what our new transformation model and structure will be designed to achieve. Hope that's answered everybody's questions.
Thank you, Derek. Philip, sorry, your hand came up after I asked Derek to speak. Is there anything you want to add?
Well, Derek didn't actually deal with the issue of children and young people's services, the children's centres. He did bat it away to the relevant department, but I think it was more a political question anyway, rather than an officer type question. So as the lead politician, I'd better deal with it. And the question was asked, do we value the work of our children's centre services? Well, of course we do. That's why we invest heavily in them. But that doesn't mean to say that those services and the delivery of those services are not going to change. And we've had one of the biggest changes in many years by bringing that service back in-house so that its delivery is coordinated in-house. And that received cross-party support, and quite rightly so. And we continue to provide a service. But Chairman, the emphasis is on service, not on buildings. And we had the old red herring thrown in again about the Huthwaite Children's Centre. The service continues unchanged in terms of going out into the community. That's what it's all about. We were left with a centre that we were subsidising for use by a local school, which quite frankly was unfair. It was unfair to be subsidising a building for a school that was getting it on the cheap. And so we decided that we would pull out of the leasehold arrangements for that building. And why not? If we weren't using the building as such, but were paying a rent that allowed other people to use it for next to nothing, that was an inappropriate use of our scarce resources. But the Children's Centre service has continued in that area, but it's gone out much more so into the community. And that's what we're finding across the county. We are changing the way we deliver the service. We're getting out to those families that really need the service, not for those that can get into a centre or want to come into a centre, which many don't. So yes, we hugely value the work of the service, the Children's Centre service, and will continue to do so under this administration. Thank you, Chairman.
Yeah, thank you, Philip. So we move on. We'll now move to the vote on the recommendations which have been moved and seconded. So Sarah, please call the vote.
Thank you, Chairman. Councillor Adair.
4.
Councillor Cotty.
4.
Councillor Creamer.
Abstain.
Councillor Fole.
Abstain.
Councillor Harper.
4.
Councillor Jackson.
4.
Councillor Martin.
4.
Councillor Meal.
Abstain.
Councillor Owen.
4.
So we've got 6 votes for and 3 abstentions. So that's carried.
Sorry, buddy muting here. So carry on to item 6, which is the report of transport and change in the adult social care and public health department. And I think, Melanie, you are going to take us through that. Thank you.
Yes, thank you, Chair. So the purpose of this report is a number of things. First of all, it's a rather delayed report on our success in delivering the departmental strategy to March 2020, a description of our activity for this year and the factors for why our focus has been on COVID response, and then a bit of a forward look to a sense of optimism. So in summary, I think in March 2020, which seems quite a long time ago, we had a real sense of optimism across public health and adult social care in the department. So we had huge success with our departmental strategy. And there's a number of some case studies and some stories from people I've put into the end of the report, which will hopefully highlight some of the success we had. We also had a very ambitious programme of a new operating model that ASH committee had approved this time last year, and a culture change programme that was due to go live April. So we were sort of paused to implement in April a number of improvement and change programmes across the department. Then unfortunately we were impacted by COVID, which has continued to have a huge impact on the capacity of the department. So obviously this impacts us in a number of ways. First of all, it's a public health crisis and incident. The Director of Public Health is the lead in the Local Resilience Forum and Emergency Response. In terms of adult social care, we know that adult social care has been particularly impacted, and that a lot of our effort is on managing the outbreaks in both social care services and the care market, and we've had to redeploy much of our commissioning team into that activity. And then clearly ensuring that people that have care and support needs has a service, that their carers are supported, is a huge priority for us. So effectively as a department, and you'll see that in paragraph 5, we've had to prioritise on a few key areas. The first is local outbreak management and our infection control. That's the absolute priority. Second to that is about sustaining the care market, implementing the adult social care winter plan, which I mentioned earlier. The other one is reshaping services. So as we can no longer meet people in day services, building-based services, we've worked really hard to provide one-to-one support in people's homes, provide care or respite under quite challenging circumstances, for example, and then have a focus on reablement and supporting people home from hospital. We did in September have a brief period where we started to stand back up some of our business as usual activity. And what I mean by business as usual activity would be things like tackling health inequalities, having a commissioning approach to mental health, things that I think are very basic asks of a Department of Adult Social Care and Health. We started to think about those things momentarily. We probably had about 3 weeks where we talked about recovery.
You're mute, Melanie.
You're on mute. You're gone into mute, Melanie.
When did I go into mute? I didn't touch anything. So does anybody know what I said last? Can you hear me now?
Standing up, where you were standing up or sitting down, not sure which, but
so I think back. Okay. Do forgive me if I repeat myself. I was just saying that we had a brief respite in September where we started to stand back up our business as usual activity and things that we would consider as departmental must-dos, like tackling health inequalities, commissioning mental health, for example. But unfortunately, that activity was stood down again as we experienced a second wave, which, as we know, with the rates of transmission that Nottinghamshire has seen and the numbers of outbreaks that public health and adult social care have responded to has been significant this time. So that has been the absolute focus of all of our staff, and as many of colleagues who stand on Adult Social Care and Health Committee know, we've had to redeploy staff into those activities in greater numbers than we did back into March and April. So the report just highlights our focus. We have from September started to have more of a focus on our culture change programme. So I'm absolutely convinced that our owning and driving performance, which is our workforce culture programme, and our strength-based approaches are crucial to help us respond. So focusing on results, focusing on what matters for the person and outcomes will help us be more robust, and that will certainly help us be ready when we can stand back up our ambition to refresh our health and wellbeing strategy and adult social care strategy in the new year. We would have been using this year to co-produce and plan that with our residents and partners. So that will be, again, somewhat delayed, but we look forward to a time when we can recover from COVID and start to, I suppose, function as a department with a strategic view again. So the report just gives a highlight of some of those areas. So very happy to answer questions, but hopefully that gives you a good overview of the sections of the report. So Councillor Adair, I think you're on mute now. I must have passed it on.
Yeah, you are. Thanks for reminding me. Oh, this muting is a bit of a problem, isn't it? So I'll go back again. The recommendation is that the Improvement and Change Subcommittee considers the progress against the Adult Social Care and Public Health Department's Improvement and Change portfolio in the context of the department's emergency response and recovery planning, and considers whether any actions are required in relation to the detail in the report. And that's the recommendation. Do I have a seconder, please?
Yes, Councillor Cotty, I'll second that recommendation, Chair.
Thank you, John. Thank you very much. And first hand up, Tony Harper.
Yeah, thank you, Chair. I'd just like to support what Melanie's said. What a good job the officers have done in this department, and I think it ought to be put on record our appreciation for everything they've done. When you look at what we've done this year and what we was hoping to do, but then of course everything was put on hold. We was reshaping services, co-production, departmental review, culture change, reablement, and then suddenly all the staff are redeployed. And then we're into caring supporters, obviously, caring for users, infection control, the winter plan. And yet we're still producing all the reports. We're still doing everything that we have by law we have to do. And I just want to put it on record what a fantastic job the officers have done in wanting to reshape everything. And then even though we've been put on hold, we've done everything we possibly can and come out of this infection and this virus in a good, strong position. So thank you, Chair.
Thank you, Tony. David Martin.
Yeah, thank you, Chair. I fully concur with what Councillor Harper's just said. You know, I mean, if anything should teach us anything, this year should teach us a massive amount. But the reality is that any of this work could be superseded by the publication of the long-awaited government white paper on social care. I've said before, and I've said time and time again, that you know, this is a really important issue. That's the ghost in the room. I've highlighted it on many occasions, and everybody knows that the council spends millions of pounds more on adult health and social care, and it's wholly unsustainable. The pandemic saw thousands of older people and disabled people die in residential care homes. That accentuated systemic frailties in the care sector. This is why the government needs to commit at the earliest opportunity to an interim sustainable funding settlement for adult social care, and to publish its long-awaited white paper on that sector as a matter of urgency. Years of underfunding have left local services like ours ill-equipped to cope with the fundamental weaknesses they must be tackled to make services resilient enough to withstand future crisis. The government has promised a public inquiry into its response to the crisis, and the government's own pandemic planning identified that social care would need significant support during an outbreak of a disease like COVID-19. Yet social care was the poor relation to the NHS when it came to funding during the lockdown. Discharging people from care homes into care homes without testing them, inadequate PPE, led to thousands of older and disabled people being in a predicament. When are we as a council going to put pressure on the government to try and complete this task? Because countless governments avoid the issue time and time again. And it's the white paper that really will make the difference to the whole country, not just to Nottinghamshire.
Thank you, Councillor Martin. Kate Fole.
Thank you, Chair. Yes, I agree with what David just said in terms of the social care, sorting social care out. And if there's a public sector pay freeze as well, which is being suggested, it's going to be a terrible situation, isn't it? Anyway, I'm sorry, I digress. I'll stick to the report now, Chair. Apologies. Just to say thank you again. I mean, from what Tony just said, the response of your department, Melanie, has been fantastic, and I think, you know, I think we're absolutely unanimous about that. So if you take our thanks and best wishes, and I hope they're not working themselves into the ground, which I know, and certainly, I mean, I go into more schools, and certainly teachers in schools are absolutely knackered. Sorry to use probably a phrase I shouldn't use live, but so thank you for that response. The difficulty we have with this, although it's a good report and it makes it reading, is it's really difficult for us to actually understand the detail, actually what is happening as a result of services with this. And I know there are some case studies, but there's 3, isn't there? And it's quite a small number. So it's quite difficult for us to actually support this. And if you look at some of the, if you look at the way that it's worded on page 36, paragraph 6, this looks to me like a significant shift Now, I have talked to my colleagues who are on the Adult Health and Social Care Committee and talked a little bit about this. And I understand that this report didn't actually go to Adult Health and Social Care. It was a different report. I know in paragraph 4, there's reference to a report on the Adult Social Care and Public Health Committee recovery plan, but the emphasis was on recovery, not transformation. So again, I question really whether this report should have come to this committee. I don't feel in a position to be able to support it because there isn't enough detail and I don't really understand it enough. But if if you took it, if it went to policy committee where you've got all your front bench people, then we could have a much fairer, a much more, I think, productive discussion around this. So that is my difficulty. I welcome as well you talk about culture change. I think that's something that's something that needs tackling across the local authority, doesn't it, in terms of culture change? If we're really going to move things forward, we've got to find ways of doing things differently. And I do understand the difficulties with that in terms of people working differently. I think I have one other thing, I'm not sure where it is now. No, I can't find it. Okay, so thanks for all you're doing, Melanie, and the ambition is really good, but there just isn't really enough detailed understanding in this report for us to support it, I'm afraid.
Okay, that's all members. So Melanie, would you like to respond, please?
Yes, thank you. So Councillor Martin, I'd agree with you. Adult social care does require a long-term plan, and we've had good debate about that both at full council and Adult Social Care and Health Committee. What has given us a slight reprieve is the Adult Social Care Winter Plan, which takes us through in terms of action until March 21, but certainly doesn't address the funding issues. And you probably will have seen the ADAS report on the budget, which was published today by ADAS, which sets out from a professional point of view the position nationally we feel around funding. Councillor Foll, in ASH Committee in October 2019, we took the detailed report for the operating model for adult social care and the culture change programme. So what this report is articulating is that both of those pieces of work were paused from implementation in April to autumn this year. So we're not proposing any changes to those reports we took. We just said that we had to pause the implementation by 6 months in order to respond to COVID. But in my view, the detail about those reports, the funding that was required, the outcomes we expected and the benefits we expected to see were clearly articulated in those committee reports from a year ago. But like I said, this report is just trying to summarise the reasons why we stalled on delivering of those plans.
Okay, thank you, Melanie. If that's it, then we'll move to the vote. We'll now move to the vote on the recommendation, which has been moved and seconded. Sarah, please call the vote.
Thank you, Chairman. Councillor Adair.
4.
Councillor Cotty.
4.
Councillor Creamer.
Abstain.
Councillor Foll.
Abstain.
Councillor Harper.
4.
Councillor Jackson.
4.
Councillor Martin. You're on mute, Councillor Martin.
4.
Thank you. Councillor Meal.
Abstain.
Councillor Owen.
4.
That we've got 6 votes for, 3 votes abstaining. That's carried. Thank you, Chairman.
Thank you, Sarah. Thank you. So we'll move on to agenda item 7, and this is the NHS Digital Pathfinders Programme. And I think, is it Annie Morgan to introduce the report, please?
Thank you. Good morning, councillors. This is an update report of the NHS Digital Pathfinders programme that's been running for about a year and is really being led within IT and adults working together. A little bit of background to this. So we've been working with our health partners since 2016 to improve information sharing, mainly around the acute hospital trusts, to sort of support the way that we work with hospitals, especially around discharges and information sharing. We have delivered sort of a number of solutions in this area, mainly around sharing information, patient information, service user information, to support either the admission process or the discharge process. We've also built in automated referrals from hospital trusts. That's about 9 hospital sites, and also alerts that come from hospital in terms of where there are changes to medically fit or discharge information. And we've also developed a product that looks to identify the correct local authority when somebody is being discharged for hospital. If you're in, for instance, Queens in the city, you could live in a number of different areas, either the city, the county, or Derbyshire, one of our neighbouring authorities. So as a background to these products and services we delivered, there's been a number of benefits that really is about automating the processes. So we moved from about 10,000 referrals a year that used to be managed essentially manually through email or telephone or fax. And that now happens in terms of seconds, systems to system communication. And they automatically go into our case management system, Mosaic, without people having to rekey the information. Other benefits are that it used to take up to 4 hours for some of this information to be transferred, and at times of discharge, that's quite key. So actually it speeds that up in terms of taking us, it's almost instantaneous. Other benefits to the programme is that people have the right information to make the right decision and to help plan, especially around care packages. The delays that were introduced with discharges going to the wrong local authority, that would have quite an impact to the patient who was in hospital. If it went to the wrong local authority, and it did in potentially up to 11% of cases, that would cause a delay for somebody who was in hospital. Colleagues at Sherwood Forest Hospital Trust estimated by automating a lot of these processes, we reduced the length of stay at hospital at Kingsmill from 21 days down to 18. The NHS Digital Pathfinders programme was a national programme looking at innovation in health and social care. There was some recognition nationally of the work that we were doing. And we were keen to essentially share that with colleagues. So we applied for funding as part of that programme and received about £316,000 to essentially develop and share this work that we have done with other local authorities. Some of the main benefits of doing that, or the main products, is that we identified information standards as part of this piece of work, and we were keen to influence the national debate on what those should be. Health had already developed information standard, but social care hadn't, and we were keen to actually promote what we had learned and the way we'd worked and information that we hold about our service users. The second thing we wanted to do was the second product that we were going to do was the system that we use, Mosaic. We wanted what we had built embedded within that system. So the funding we received essentially meant that what we had done was developed into the Mosaic system, so all customers across the country could benefit from those functions within their system without having to pay any additional funding. And the third product that we were sharing was actually to enable that correct locating for discharges across all of England. So actually other health trusts would have the same benefits of identifying the correct referral route for people. Next steps, the programme is nearing its conclusion. It's due to be finished at the end of February. There's been some delay as a result of COVID, but hasn't impacted directly. So we're really looking for a sort of ratification of the approach. So that's really in conclusion of the programme.
Okay, thank you, Annie. Thank you for that. And the recommendations are on the back of that the subcommittee considers the content of this report, provides feedback and ratifies the approach set out within it, and the subcommittee agrees to receive further updates as appropriate. That's the recommendations. Do you have a seconder?
Yes, it's Councillor Cotty. I'll second that, Chairman. Thank you.
Thank you, members. Councillor David Martin.
Yes, thank you, Chair. Well, it was questioned earlier why I came on this committee, and this is exactly why I came on this committee. I'd like to congratulate the staff on their mammoth effort here. For far too long, this has been a minefield, and the mosaic means that the correct local authority for every discharge from a hospital can be identified within seconds is especially welcome. And the work that this county council has done to share the information with the Sherwood Forest Trust, Nottinghamshire University and Doncaster and Bassetlaw Teaching Hospitals is also welcome, along with the Smarter Working programme, which enables all of the care workers and the START programme to function at its best and increase output phenomenally. And when I talk to people about words from adult health and social care, the one that sticks out foremost here is interoperability. And that's great. That's really great. And also as well, you know, this is a great leap forward in technology. So it clearly shows and beggars belief as to why we're still planning to build £28 million worth of new buildings when all of these people are now working on the Smarter Working programme and through the mosaic instantaneously, and they're all doing it just like you from home. So why would we extend the empire while Rome burns?
Thank you, Councillor Martin. No other members. So, Anne, have you got anything to feedback on that, or are you okay?
No, other than thank you for your comments, Councillor Martin, and I will feed those back to colleagues working on the programme. Thank you.
Yeah, thank you very much. Thank you. And we'll move to the vote then. And Sarah, can you do the vote for us, please?
Thank you, Chairman. So I'll read the names in turn. Councillor Adair.
4.
Councillor Cotty.
4.
Councillor Creamer.
4.
Councillor Fole.
4.
Councillor Harper.
4.
Councillor Jackson.
4.
Councillor Martin.
He's muted now. Still muted, David.
Thank you. Councillor Meal.
4.
Councillor Owen.
4.
That's unanimously agreed, Chairman.
Thank you very much, Sarah. Thank you. And we'll move on to agenda item 8, which is Cloud Programme update, to brief members on the progress and direction of the Cloud Programme. And I think we have Stuart Reekie to introduce the report, please.
Thank you, Chairman, and good afternoon, members. We last provided a cloud update in June, and so we're giving a bit of a brief overview on progress over the summer and into the autumn. And just as a brief overview and a reminder, there's 2 of the key objectives of the cloud programme is to move the council towards modern computer services and also to reduce the amount of equipment back in County Hull's data centre. So I propose just to go through some of the key points in the report and have some questions at the end. So paragraph 3 is really just introducing some of the terminology, which can really be summarised down into the one word of choice. There's many different approaches, many different platforms and many different products. Our way of approaching this is to look at each system in turn and provide an assessment, often working with the provider and the supplier of the platform. And it's quite tricky sometimes with products and applications that predate cloud technologies. Thankfully, the suppliers, they're well on board with this and they're already bringing out new solutions all the time to help us. And that brings us down to paragraph 5, where 2 of the milestones I'd like to pay attention to. The first of them is about the web applications design. Over the summer, we have been working with Microsoft and our partners to look at a design that will support the easier transition of our web applications. These are the things that sit on the intranet and on our internet. They probably don't even get recognized as an application, things like the pothole reporting service. So we've designed a solution that now works, that's been tested, and those applications are now being scheduled for migration over. The second of the milestones that's worth paying attention to is that our reliance on our data center in County Hull has now shifted. We have migrated so much equipment and so many services over to our partner data center in the commercial property in Derby that our primary data center in County Hull is now essentially there for resiliency and some site-specific applications that can't be moved off of the property. Things like the door card system, for an example there. In paragraph 7, the report describes our unexpected displacement over the summer and our rapid adoption of Teams. And I'd like to take an opportunity to thank the whole of the organisation, really, because as I see it as quite a successful adoption of Teams, it wouldn't have been possible without everybody's support and our willingness to move forward and to take on change. This is, I've worked in the organisation for 20 plus years, and this is kind of a unique situation. The momentum and the pace of change has been really supportive, really positive. And one of our key attributes is going to be to keep that momentum going as we move forward into the next round of applications and products and services that will help support the business to deliver the key frontline services to citizens. So paragraph 14 onwards, we describe around the cycle of identifying the next batch of products, promoting them, and educating the users on the best way to use them to really facilitate the advantages and to bring them about key deliveries. The piece of technology that I think we've identified over the summer is that whilst we can work from home and while services can function, where technology is really beneficial is in connecting users both within the hierarchy and across departments and to ad hoc specialists. We don't have the resources to be able to speak to every user, and what we will be facilitating is enabling the users to speak to their local specialists, those that use the systems best. So we have a line of products that we're at the evaluation stage ready to bring online over the next 6 months, which will help facilitating cross-team communications. In paragraph 18 and onwards, what we're trying to identify here is that the lessons we've learned this summer is going to have a massive influence on how we approach our future use of technologies, how we manage to value the connections between sites and services, and how we connect different people outside of the traditional 9 to 5 hours through system automation, conversation, and trying to reduce journeys by enabling building to building conversations in a consistent experience. If we're going to really maximize the use and support of the flexible home working and everyone's changing world in 2021 with their own personal situation in this outbreak, what we really need to happen is that whether the person's working from home, working from a remote site, or working in a different county, the meeting experience has to be consistent. And so we're building a collaboration ecosystem which will help support this. What we can't do, though, is we can't deliver this in our own right. This isn't something that's going to win if ICT does this to the organization. The big key piece here is collaborating with other initiatives, other programs, such as the transformation plan, and making sure we hear how it needs to be used in the county by the business at the front line, and really quickly tailor and deploy the services that will be most effective for most of the people. So in summary, 2021 appears to be quite a year of challenge ahead of us, and we're looking at our product set ready to deliver more flexibly, more quickly. And thank you for the time, and I'll now be on hand for any questions. Thank you.
Okay, thank you, Stuart. Thank you for that presentation. I just refer to point 24 in your report. Technology solutions will not be produced in a silo and must be developed in conjunction with other initiatives, service areas, and the transformation plan. I think going forward, the team's development, the whole thing has got to be very much focused outwardly instead of inwardly. So thanks for that. And I'll go back to the recommendations, which say that the committee considers if there are actions arising from the report and presentation, that the committee agree to receive regular updates from the cloud programme, and that's the recommendation. Do I have a seconder for that, please?
Yes, Councillor Cotty, I'll second the recommendation, Chairman.
Thank you, John. And Diane.
Thank you very much, Chair. Just to say, I really welcome this report. I think it's really quite exciting what has been done, and then what you're in prospect to be done. In particular, the work you were talking about, cross-team communications, very valuable. And then just as you say, as the chair has said, that this isn't about doing technology solutions to people, it's about co-producing them. I'm very pleased in paragraph 20 there, not every work situation can be done at home setting. Really important thing to recognise that council sites should support a broad selection of drop-in attendance, providing choice from casual and informal seating to boardroom. and including different sorts of meeting types as well, you know, from solo working through to, and I love the idea of energizing team spaces. I think that's a wonderful thing. It conjures up all sorts of stuff that are very, very different from the current format that we have for working on site, if you get my meaning. I just wondered what progress has been made around rethinking how we work, all these different opportunities for engaging both as councillors but also staff engaging. And my sense as well that this is about the health of staff, you know, getting not only the work-life balance correct, but making sure that staff and ourselves can be as creative and productive as possible and getting the right environment and the right tools for being able to do that. I just wondered sort of what progress has been made around all that.
Okay, thanks, Diane. Jim, Councillor Creamer.
Thank you, Chair. Diane said a lot about item 20, and I just wanted to link into that with that. It's coming. My programme might close. I don't know if you can see.
We can see it. We can see it. We can hear you.
There's a warning come up, closed programme. So very quick. Item 11 on about the actual, not everybody can update from home, etc. Is there any thoughts going into what the problem is now? How many people have that problem? I assume it's down to broadband, lack of capacity in certain areas. And is there a way around that, which I was linking to item 20, of actually going into the libraries, even though closed, to make the updates? Yeah, and other buildings, so utilising those. But do we actually know how big that problem is at the moment? And with new facilities possibly needing a broader broadband width for the users, is it worth actually saying we all need a minimum of this, and then working with the staff and with the council to say, well, this is what you've got in the future, you will have to update it or whatever. So, but apart from that, everything's good. Thanks for all the work you've done, and I hope I don't drop out with this warning come up. Perfect timing, because when I've had problems before,
you look all right. You're going strong, Jim. Don't worry about it. Okay, thanks, David Martin.
Yeah, thank you, Chair. Again, this report highlights the leap in technology and what an advantageous thing it is. When you talk about the work-life balance, I could do with knowing a bit more about how you, as an IT, plan to address that, because obviously that could be addressed through some kind of interactive scheme with work colleagues, because that's the kind of thing, that's the way we're going, you know. And let's be clear about this. We talked earlier about creating carbon neutral workspace. Well, you couldn't get any more carbon neutral than this, and this is the way the world's going. The pandemic has accelerated that issue, and yet again we'll have millions of pounds worth of buildings empty and unusable, because this is the way the world is moving, and that's the reality of it. But I would be very, very interested to see how the programme is going to help those people working from home to strike that correct work-life balance, because it can be a very accelerated degenerative path for some people who really run on an automated system. They get up at 6:30, go for a run, take the dog for a walk and go to work. That thread has gone. So something needs to be done about that. That would be an improvement and change for the mental health and well-being of the staff going forward, I believe, in my opinion. Thank you.
Okay, thank you, Councillor Martin. We've now got Marge. You would like to say something?
Yeah, I was going to pick up on the workforce bits that Councillor Meal and Councillor Martin raised. So last week at Personnel Committee, the committee approved a workforce resilience and recovery strategy and action plan to address some of these issues. So there's a number of themes in there. Wellbeing is a critical theme. Organisational development, culture, we've talked a lot about that today. People development, leadership development, smarter working. How are we going to capture what we've learned and has been positive about working from home and build on that going forward, and having that sort of mixed economy that Stuart was talking about. There's also a big piece in there about communication and engagement. What we've done is we've created a cross-council group of officers to lead on that. So we're taking the learning from one part of the organisation where they've developed something and applying that across the piece. And that's really positive measure, and that's how we will tackle some of these issues that you're talking about people's mental health, people's resilience, and making sure we've got that, we're addressing that as we go forward from here. So thank you.
Thank you, Marge. Thank you very much. Derek, you also got your hand up. You'd like to say something.
Thank you, Chairman. Yes, it's just really to build on Marge's comments, actually, and to pick up on those questions around smarter working more generally. It's absolutely the case that the pandemic has driven lots of innovation that Stuart's outlined around remote working and different ways that we've enabled through technology staff to work effectively. And what we're doing is we've done 2 staff surveys now, and we're taking a lot of that learning and have developed a revised and new approach to smarter working for consideration by members, probably at the next meeting of the policy committee, so that we can take into account all of that learning from COVID and all of the work that we've done around our building rationalisation programme, characterised through the Investing in Nottinghamshire programme, and kind of blend those things together. Because one of the things that we have learned from our staff is that whilst new ways of working have been welcomed with open arms by so many colleagues, there are limitations to that. And we still need to be able to utilise our premises and our service delivery buildings in particular for face-to-face contact, both from within staff groups and teams, but also with service users, clients and residents as well. So what we're hoping to do is to bring that kind of blended approach back in front of members this side of Christmas at Policy Committee for a fuller discussion, because we're quite excited about the direction of travel.
Thank you, Derek. Stuart, would you like to add anything at the end of all of that?
Please, if I may. Councillor Meal, I think and Mrs. Tward answered your questions, if that's okay, around the energising and the workforce. Councillor Creamer, you asked around the broadband and the update from home. That's really a network configuration issue, more so than the home broadband. So the size of a person's broadband capacity varies far too much on their own personal state. So where they live in the country, whether it's countryside, urban, etc. Now, whilst we might be able to give some guidance on good speeds or recommended connection speeds, what we can't do is really force that agenda. Instead, what will happen is it will throttle down and it might take longer to deliver the update. What we are doing centrally is, instead of bringing the update from County Hall, spraying it out from a hub along the spokes to all the individuals' homes and throttling that connection, we're changing where they get the updates from, so they get it direct from the internet, which means it only passes through their link once and makes much more efficient connection path. Does that make sense? Is that okay? The piece that you also mentioned needs to be supported with education. And this is going to be one of our key things, I feel, is that we need the right balance of process, governance, education, and technology. If any one of those is out of sync in terms of the balance, it's not going to be very smooth. So we're focusing on that and working with, such as our deployment specialists, our platforms. We have the 365 hub on the intranet, and we'll be deploying more conversation tools that will allow ad hoc, dynamic, and engaging conversation with all users across the whole of the organisation. Councillor Martin, you mentioned about the work-life balance and carbon neutral. I think that the piece here is, I think we've recognised that whilst we can work from home and whilst technology does enable us to do the function, we're all missing that part of human connection. And what the report was trying to cross over was that the nature and the way that we use buildings has to be reviewed. We have to learn the lessons from this summer. There are some meetings, some conversations that are just inappropriate to work remotely. What technology can do is to help reduce the need for travel. So the intention is to be able to connect local remote sites of the county council premises so that the person can travel 2 miles to the nearest office and have that same collected experience for meetings, rather than traveling across the county to meet everybody in County Hall or to go up to Sir John Robinson Way, for an example. If we can reduce the level of meetings, what we're doing is we're giving the users choice. They can choose where they can work, and the access to the services should be consistent no matter where they're based from.
Stuart,
Some people will.
Stuart, I think there's a major bit of work going on in this direction, so I would
Yes.
leave it there for now, because I know there's a major bit of work going on in that direction.
And the element, Councillor Dare, I think that's worth mentioning is that we are plugging into that, supporting that, and will be connected and parallel along with its ambitions.
Okay.
Thank you.
Okay, thank you very much. Thanks for all the comments, and now we will move to the vote, please. And Sarah, can you do the vote for us, please?
Thank you, Chairman. Councillor Adair.
4.
Councillor Cotty.
4.
Councillor Creamer.
4.
Councillor Fole.
4.
Councillor Harper.
4.
Councillor Jackson.
4.
Councillor Martin.
4.
Councillor Meal.
4.
Councillor Owen.
4.
That's agreed unanimously, Chair.
Thank you very much, Sarah. Thanks for that. And let's move on to agenda item 9, progress report on delivery of improvement and change programs, projects and savings. And I think Sue Milburn, you're going to take us through that.
Yes, thank you, Chair. So this is the regular update on improvement and change programmes, projects and savings. And so the purpose of the report is to provide an update by exception on those departmental improvement and change portfolios, and to inform the subcommittee on the progress towards delivery of the Council's current savings and strategically significant programmes and projects. As ever, there's quite a lot of detail within the appendices. So Appendix A has the exception report relating to the departmental improvement and change portfolios. Appendix B and C focus on the savings and the strategically significant work. And on this occasion, Appendix D gives a proposed new reporting template for the adult social care portfolio, with adults having completed the Improving Lives portfolio and revised their work structure. So this is what the report will look like going forward. So if I take us to the overall status, overall the portfolios, the total savings target over the 4 years is 24.8 million. And as I said before, the detail of those departmental savings can be found in the summaries in Appendices B and C. We have notification of those projects with outstanding change requests or write-offs. So in point 11, the projects of housing with care and better practice in support planning for over adults. We have change requests there, which went to committee in early November, and also the notification of changes that came to this committee in July on the social impact bond and development of fostering service. And again, in point 12, it refers to that portfolio report for adult social care and health, and just the note that because that's just a model at the moment, those figures may be inconsistent. So I've galloped through that, Chair, but clearly we can go into the appendices if anyone's got any detailed questions they want, or any points in general about what's in the report. Thank you.
You're muted, Reg.
Muted. Sorry, Sue, thanks for that. And I was just saying that you do know how to get us into appendices, don't you? So the recommendation is, it is recommended the subcommittee considers the departmental improvement change portfolio update and the quarter projects and savings update, and decides whether any other action is required. And I make that recommendation. To have a seconder, please.
Councillor Cotty, I'm happy to second that recommendation.
Thank you very much. And that is seconded. Does members have any questions on it? I've got Councillor David Martin's hand.
Thank you, Chair. Morning, Sue.
Morning.
Our first question relates to Appendix A1 and the projected saving of over £2 million on the service to help people regain skills and confidence or recuperate after an illness. This process was started in September. Could you explain what this actually means and what effect it could have, COVID-19 will have on this? The second question is Appendix A2, submission of planning application for the new office development at Top Wigay Farm in Hucknall. This was due in September 20, but it's experiencing obstacles, and you say it's due to planning decisions and for the wider site. What are the reasons for these delays, and how confident are you that planning will be submitted in January? The final question is Appendix B, remodelling children's centre service. In it, the council aims to save over 1 million over the next 2 years, 870,000 this year and 130,000 the following year. Is this saving as a result of bringing the service in-house, and what effect on the services will it have if that's not where the savings being found? Thank you, Chair.
Thank you. I've got no other oh, Diane Mail, yeah. Oh, now I've got Kate Fole as well. So Diane first.
Thank you, Chair. Just a couple of questions. One is about on page 63, delivering high quality public health and social care services. It's at the bottom of that, it confirmed commissioning strategies for housing with support to offer a range of housing options which will help people under the age of 65 to stay as independent as possible for as long as possible. I just wondered what the delay, the reason for the delays around that are, and are we still looking at an implementation date of March 2023? And the other one was on page 68, again looking at the Investing in Nottinghamshire programme, and it's the second block down, which is about complete detailed design for new build on County Hall site, West Bridgeford, and present committee for decision. I just wondered again, that was due for September 2020. I just wondered again, have we got, what's the revised time scale for that, and what are the issues around it? Thank you.
Thank you very much. And Kate Fole.
Thank you, Chair. Yes, thanks for this report. So it's very comprehensive, so thank you. I'm in the yellow pages now, Programme 1, consolidating the new department chief executives. You've got under key milestones, undertake a review of pricing and charging that was due to be completed by May 2020. We're just wondering where that's got to. I think Diana's already mentioned the Investing in Nottinghamshire one. There's one in just to say brilliant that we're exploring vocational education pathways. I don't know which heading this is under, so we could do the headings at the top of the page, couldn't we? Future of education support. This is on page 79. I'm really pleased that we're looking at that. It's well overdue in my view. And then there's another one. It's in, if I can find it. Apologies. Yeah. This is under open new schools and childcare provision as a result of housing developments. This again is under the future of education support. It talks about, this is the top box, the Sharp Hill Primary School, to be sponsored by the George Spencer Trust. Whilst the building will not be completed by September 2020, interim plans are being negotiated with the Trust to ensure that pupils will be admitted into the school in September 2020. I'm wondering if the date's wrong there. But clearly there's something up, there seems to be something up there. I think that's me done. Thank you.
Thank you. I think that's all members. So Sue, do you want to respond to that, or do you need some help with it?
I may call in on colleagues in the room, because as you'll see, there's a lot of detail in these, and quite often departmental colleagues are able to help me with that. So I'll go to Councillor Martin's questions first. So in terms of the adult side of things, and that question on people who benefit from short-term services, Melanie, would you be able to comment on that?
Yeah, so if I can just pick up the two questions that relate to the department, so I'll do those in one go if that's okay.
Can't hear you, Melanie. Sorry, we can't hear you.
I think it's where your microphone is, Melanie.
We can hear you now.
Is that better?
Yeah, we can hear you now.
My apologies. I was just drinking a mouthful of tea, so I must have moved the mic. I'm sorry, everybody.
All right.
If I can take up the two adults questions, that would be helpful. So, Councillor Martin, we are expecting that project to deliver. If you recall the business case, I know it was some time ago, we took to Adult Social Care and Health Committee October 2019 with the workforce operating model. We disinvested in staff in the strategic commissioning team and transformation team and invested in the reablement service. That was paused until September 2020 in terms of implementation, but that work is now live. So we are currently recruiting to that service. So we are expecting to see the benefit of that. So clearly we have an investment in our internal services capacity in the reablement service, and we're expecting that to reduce some of the costs within the care market. So that work's ongoing. In terms of housing with care and support, the main obstacle at the moment we're facing is that the housing work right across all of our district and borough councils has been particularly strained because of COVID. So what we saw, particularly through Q1 and Q2 of this year, is that because of the Everybody In campaign with the rough sleeping initiative, because of the extra demand on housing pathways, because of domestic abuse and women fleeing domestic abuse, and because of the need to be supporting people both from mental health and physical health discharges, there's a real strain on housing and the housing sector. So that has meant our work to support people into independent accommodation from placements into independent living has experienced obstacles for that issue. So that's the main reason why those two pieces of work. And do forgive me, Councillor Mill, I can't remember if you said housing with care or housing with support, but there is a pressure on both of those elements. Is the housing pathways our district and borough colleagues are facing is causing that pressure there.
Thank you, Melanie. Sue?
Thank you. Derek, I'll ask you if I can, please, to answer the place ones.
Thanks, Sue. Yes, I think, members, those questions were largely around kind of property-related matters. So, Councillor Martin, you asked a question, I think, about Top Weekhay. We'll be bringing an update report to the next meeting of the Policy Committee on our broader Investing in Nottinghamshire programme, I think, and that will include an update on Top Weekhay. But broadly speaking, we've had some COVID-related delays with the work that we've done around the programme, but we're intending to go for planning in the new year, as far as that's concerned, for the new office build. Councillor Meal, you asked a question around County Hall and the development of the options for a new build. We've been looking hard at what our options are around that, again in the light of COVID, and the discussions actually that we've had at an officer level have been similar to one or two of the ones we've had this morning in committee around the kind of implications of COVID for different ways of working. And again, we'll be bringing an update on our position with that to the next meeting of the Policy Committee. And Councillor Fole, you asked a question around Sharp Hill. I suspect the entry in the appendices might not be entirely up to date, but Sharp Hill, the new school with George Spencer Academy Trust as the sponsor, has opened in September on time. But the issues around the site and the timing of the build meant that we couldn't open the new school in its entirety. So we've opened some new buildings, but we've also got some temporary provision on site. That, whilst the remainder of the new build continues, that mobile provision will be taken off site early in the new year, with the entire school finished in time for Easter, but the school is functioning and operational as planned and on time.
Thanks, Derek. I'm not sure if we have anyone from Children's in the room, but my perspective on those questions are that in general those delays are due to the COVID impact, and in some cases we haven't had the chance to reschedule when we think those delivery dates will be there yet. And I think the last one I missed, Councillor Fole, you asked about I think consolidating the new Chief Exec's department, is that right? Sorry, Councillor Fole, you're on mute.
Sorry, officers, does anybody else remember what was asked?
It was the undertaker review of pricing and charging. The review will be completed by May 2020. This is under Programme 2 Commercial Strategy.
Right. I don't know if anyone else in the room can help me with that one, but if not, I will come back to you on that one, Councillor Fole. Sorry. Okay. All
right, Sue. Anybody, anything? No, nothing else then. Okay, that's fine. Thank you very much, and thanks for taking us through the programme. It's quite a difficult one because it's quite lengthy, and also there's a lot of recommendations and dates and all the rest of it to take care of. So having said all of that, we've discussed it, and now we'll go to the vote. Sarah, please.
Thank you, Chairman. Councillor Adair.
4.
Councillor Cotty.
4.
Councillor Creamer.
4.
Councillor Fole.
4.
Councillor Harper.
4.
Councillor Jackson.
4.
Councillor Martin.
4.
Councillor Meal. 4. Councillor Owen.
4.
That's agreed unanimously, Chairman.
Thank you very much. Thank you, members. Thanks for all of that. And the last thing on the agenda is the work programme. And do we accept that in general, because we can add and subtract from it as we go forward? Kate, you wanted to say something?
Can I just ask if we think again about where the transformation and change programme reports go to? I was referring back to a comment I made earlier about whether it should be this committee or whether it should go to policy.
Transformation and change programme come to improvement and change subcommittee of the policy committee, and if it gets through that, then it progresses through to policy. Sorry, Kate, but that's the way it is for now. Thank you. Any other questions about the work programme? No? Okay, so we take it as read, and then it can be improved as we go along. Okay, all right. Thank you very much. Thank you for attending the meeting. And I was going to say a safe journey home. I'm the only one, I think, that's going home from here. Thank you very much. Cheers for now. Bye.
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 Thanks, Chairman.
Okay. Thank you.